Gambling disorder is a condition featuring a pattern of recurrent maladaptive gambling behaviour that leads to clinically significant impairment or distress. Gambling involves taking a risk on an unclear outcome by risking something of value, typically money, with the intent of trying to win something of higher value. It is also sometimes known as problem gambling or gambling addiction. There are 9 core features of the disorder, including a need to gamble with increasing amounts of money in order to achieve the desired excitement, being restless or irritable when attempting to cut down or stop gambling, making repeated unsuccessful efforts to control or stop gambling, a preoccupation with gambling, for example, having persistent thoughts of reliving past experiences, planning the next venture, or thinking of ways to get money with which to gamble, gambling when feeling distressed, chasing one's losses, meaning after losing money, returning in an attempt to get even. 7th is lying to conceal the extent of gambling, and 8th is a history of losing a significant relationship, job, or educational or career opportunity because of gambling, and the 9th is relying on others to provide money to relieve desperate financial situations caused by gambling. The DSM-5 criteria for a diagnosis require 4 or more of the above within the last 12 months. It also requires that the gambling behaviour is not better explained by a manic episode. The International Classification of Disease, ICD-11, lists 3 requirements for a diagnosis, which are impaired control over gambling, increased priority given to gambling, taking precedence over other life interests and daily activities, and continuation of gambling despite negative consequences. It is an under-recognised condition with an estimated 1% prevalence in the UK and United States, with 4 to 7% of the population thought to be gambling at risky levels that may become a disorder in the future. Risk factors include a younger age and male sex, with males being 4 times more likely to be affected, although females can also be affected and tend to progress to gambling disorder more quickly. Low income and poverty, family history, and trauma are also thought to be risk factors. It's estimated that only 10% of those with the disorder will seek help, and often there is a coexisting substance misuse disorder, anxiety, or depression, and that up to 1 in 3 have thoughts of or have previously attempted to take their own lives. Management is focused on retraining the brain pathways involved in reward and excitement. No medications are currently licensed specifically for gambling disorder, though pharmacotherapy has been shown to be effective in some placebo studies. The main evidence is for opiate antagonists like naltrexone, showing a small but significant benefit, though antidepressants like SSRIs and mood stabilizers like lithium have shown some benefit as well, though there is less evidence. Therefore, the bulk of management is through non-pharmacological methods. Cognitive behavioral therapy has been shown to be beneficial. The cognitive model of gambling disorder centers on gamblers having erroneous beliefs based on false assumptions, such as having any control over luck, and CBT aims to correct any distortions or biases. Motivational interviewing is another method aiming to encourage the individual to analyse their gambling behaviour that is typically underestimated and compare to the general population in order to promote a behavioural change. 4 principles underlie motivational interviewing, which are expressing empathy, developing discrepancy between an individual's current behaviour and his or her goals, rolling with an individual's resistance to change and not arguing or opposing the resistance, and finally supporting self-efficacy and one's ability to succeed in change.